Good evening. My name is Jose E. Baez. I'm a OBGYN with HealthQuest. I've been practicing in the community for more than 30 years. Today, we're going to discuss a topic that is very prevalent and important in our community, and that is menopause. Menopause is defined as 1 year, 12 months without a period. That is usually the objective way of a woman knowing that she is at that phase of her life. The average age for menopause is 48 to 52 years of age. The symptoms, however, begin many years prior, and sometimes there is no cessation of bleeding until well into a patient's 50s. But the bulk of the population of women tend to stop bleeding, as I said before, around 48 to 52. Menopause is not a disease, and it is quite treatable in spite of the fact that these symptoms, as I said before, can last for a long time. Unfortunately, over the last decade, there's been a lot of misinformation about the treatment, which we'll get into it later on, and how to resolve these issues. There are several symptoms that bring a patient to our office. The hot flashes, the mood swings, the night sweats, irritability, vaginal dryness, and loss of libido, together with irregular period. These are the most common symptoms that suggest that a patient is entering that second phase of her life known as menopause. The symptoms are quite controllable. They are triggered by the lack of estrogen. Estrogen is what every cell in a woman's body is craving for at this time of her life. Women, unlike men, have a cessation of the production of hormones by the ovaries. And it's not just estrogen, it is also testosterone, which is why there is the loss of libido as a woman enters menopause. There is loss of estrogen, which also triggers the night sweats, the hot flashes, and the mood swings, etc. They can last decades, these symptoms, and they can cause a lot of disturbance, not only in the patient herself, but as well as affect her family members. Sometimes it is common to send a patient to the lab for blood work to officially document the status of her situation, to make sure that she is indeed in menopause. That is easily done with blood work. But as I said before, if a patient is in her early 50s and she comes to our office complaining of those symptoms like the hot flashes and the night sweats, which seem to be the most uncomfortable of all the symptoms, it is usually not necessary to do lab work when you know that that is probably what is starting to occur. The diagnosis, as I said, clinical as well as with blood tests. But the more important time-consuming the conversation is on the treatment. Prior to beginning any kind of treatment, it is important to discuss with a patient and to ask her a couple of important questions. One is, does she have a family history of breast cancer? That has become a significant and important question because in the early 2000s, around 2002, there was this study that came out that suggested that if women were treated or took hormones to treat their symptoms of menopause, they would run a 30% chance of developing breast cancer. That study, which is called the Women's Health Initiative, or WHI, managed to scare many women And I remember vividly in those days how patients were calling literally the next day to stop taking their medications because this article came out and it was in Good Morning America and people were afraid of developing breast cancer. That study has been debunked and refuted many, many times over. That is absolutely, categorically not true. The most important question to ask a patient is, does she have a family history of breast cancer? And by that I mean the maternal line. Does the patient's mother have breast cancer? Does the patient's maternal grandmother have breast cancer? Does she have a sister or a daughter with breast cancer? If the answer is no, then that patient has no contraindication not to at least try to control and to treat her symptoms. That is why that is one of the most important things to discuss with her during that visit. Treatment consists of not just medications, it could also be alternative treatment as well. And we'll discuss that in a few minutes. The incidence of breast cancer in the United States is 1 out of 8 if a woman lives to be 90. If a woman chooses to take hormones, the incidence of breast cancer rises to about 1 out of 7. So there is a slight increase, but it's not that substantial as that study suggested of 30%. So that again, a patient that really has no family history specifically about breast cancer should not be afraid to consider using hormones or any other alternative treatment, as long obviously as it is under supervision. The treatment consists of conventional estrogen and progesterone, especially for women who still maintain a uterus. For those women who do not have a uterus or have had a hysterectomy, there's no need to protect the womb. Progesterone is there to prevent the thickening of the lining of the uterus from unopposed estrogen. Again, estrogen is the key ingredient that needs to be prescribed. It comes in a variety of forms. It could be in patches, which is very physiological and is the standard recommendation. It comes in pills, it comes injectables. Either way, a woman who has a uterus should use estrogen and progesterone. The estrogen, as I said, to control the hot flashes, the night sweats, and the horrific symptoms that make her come in to see the doctor. The progesterone to protect the uterus from endometrial cancer, which is sometimes associated with those patients who just take estrogen alone. Sometimes patients do not wish to take the standard treatments and they opt for alternative or natural treatments. And that's okay. It usually does not work as well as the standard treatment. Compounds are derived from organic sources. For example, soy, we know, contains a great deal of natural estrogen. Tofu, there's black cohosh, there are yams, and even apple cider wine vinegar, which I've been told has helped many patients in more ways than one. You also always have to offer the patient alternative treatment because not everyone is ready and willing to accept the standard treatment. However, it does not usually work as well as when you take the standard pills or patches. The symptoms of menopause will last decades, as I stated before, and it is a quality of life issue. The important thing is to have a conversation with a patient that enlightens them, that provides them with accurate information, and then the patient should decide whether or not that is the way to go. I urge patients always to investigate, I refer them to the American College of OBGYN in their section on menopause. I also refer them to the North American Menopause Society for information on this topic. Here at HealthQuest, I give patients information from our platforms as well on this topic. So there's a host, a variety of sources that I like patients to investigate and to consult, together with, of course, having a conversation with their gynecologist. Here at HealthQuest, we're here to serve you, and we will be delighted to answer your questions and address your concerns on this very important topic. Have a good evening.